Ask the Messenger's TV show is a TV show that educates, informs, and entertains our viewers on public health issues such as mental illness, suicide, addiction, illness and disease, COVID-19 relief, crime, domestic violence, homelessness, human trafficking, employment opportunities, healthcare, and more. And now, ask the Messengers.
The DWIHN Integrated Health Network provides services and support to 75,000 people in Wayne County. DWIHN serves people with mental illness, intellectual and developmental disabilities, individuals with substance use disorders, and children with serious emotional disturbances. DWIHN is the largest and most diverse community mental health agency in the state of Michigan, and it is committed to providing the highest quality of integrated health care to those it serves while working alongside with dedicated and compassionate provider network. Today on Ask the Messengers, we bring you another DWIHN Integrated Health Network Provider Series. First up, President and CEO Eric Doeh brings some very exciting news about what's new at DWIHN, plus a network provider spotlight featuring Sacred Heart Rehabilitation Center. We are pleased that Paula Nelson, President and CEO, is here to share information about one of many of their services that they provide. Ask the Messengers begins now. So we are super excited to have Mr. Eric Doeh, the President and CEO of DWIHN Integrated Health Network, back with us again. He is here to just continue our conversation on what their organization provides for the big old Wayne County. Every mental health, substance use, you name it. If it's a resource, I can guarantee you this man has something to do with it. So we are very honored to have him again back with us. And we're also honored with our partnership as well. So welcome back and welcome to the show, Mr. Doeh.
Thank you so much, Tina, for having me. What a pleasure. Always good to be amongst good people.
People see the billboards, they see the commercials, they see you on buses. But what about those that see this but don't really know what the DWIHN network, what is it really? So when they see it, they know, oh, I know what that is. Help them out.
Absolutely. What a great question. You know, I always tell people we don't want to be that great restaurant that sits on the corner and that only a few know about because they have the greatest pasta dish. You know, we want to be a resource within the community. You know, so at DWIHN, or the DWIHN Integrated Health Network, you know, we provide an array of services when it comes to mental health services, as well as substance use disorder services. And the amazing thing, though, Tina, is that these services are free. Folks, you didn't mishear me. They are absolutely free. They are your tax dollars working for you. And, you know, in this day and age of where we've had to deal with so much, whether it's been COVID, whether it's been trying, you know, to just juggle the everyday life. I mean, a resource as the one that we offer at DWIHN is so important to our community. And that's why we are invested within this community and invested with partners such as yourself. We are here to help folks. So whether you have insurance, you don't have insurance, you know, you have limited insurance, we will link you to providers within the network. We have well over 300 providers within the network. So rest assured, within your neighborhood, whether you're coming from Canton, Detroit, you know, Livonia, you name it, we have providers in those communities.
Okay. There's something brewing in the network. You guys have an upcoming construction with the care center. Yes. So can you tell us about the construction, what's going on, what to expect, what's the timeline? Give us the goods, give us the 411.
This care center is our crisis center, you know, Tina, and for so long in our community, we haven't really had a crisis center. And what I mean by that is that we've had a number of our providers who've stepped in and have done a tremendous job, but we don't have that building, that structure that stands to provide such an amazing resource to our families, to our law enforcement communities, to our members. And so how it works is this, Tina, within your community such as mine, we have urgent care centers. And why do we have those centers? Because they know that one day someone like myself will be in the kitchen cooking something, probably cut myself or do something, and will need to not necessarily go to the emergency department at a hospital, but just someplace urgent care so that I can get myself stitched up, bandaged, and ready to go. Now, this is exactly what that is, but on the behavioral health side, on the mental health side. And so for a county such as Wayne County, 1.6 million people, and when you just consider Detroit alone of roughly 700,000 folks, for us to not have a crisis center, that is just not acceptable. And so for the last 5 years or more, we've talked about this thing at Detroit Wayne, and finally we're going to put shovel in dirt and build this thing here right at 707 Milwaukee. It's going to have the resource of almost 40 beds. We're going to have bed space for kids as well, for adults, so that when family members, are struggling with their loved ones and just need some place to get some reprieve, to get some help, to get that family member stable, or even that individual, him or herself, they can go directly to that care center as opposed to going to the emergency department. When our law enforcement, partners, when they get those calls or come upon those folks who just need, that service, they can come on to the care center. This project is going to take us 1 year to complete. And Tina, if I have anything to do with it, which I do, and if they will lend me a hard hat and a hammer, I would get it done as fast as I possibly can. But we want to make sure that we build something that is not only state of the art, but it's also a good representation of our community. And it's a good representation of the fact that we want to make sure we serve our people, not just by building something to say that we've built something, but to build something that can truly, serve people for longevity. And that's what we're doing. This space is also going to offer sober living as well. So for our family members, ourselves who are struggling with substance use disorder, this will offer that reprieve and those resources. I mean, you're talking about on the mental health side, a 72-hour hold period there where someone can go and get stable. If you need that to be longer in terms of additional days, that will also be provided too, because we just don't want to be a resource where folks step in and, we put a bandage on it and say, hey, see you later. We want to connect people to resources. So imagine going to the crisis center or the care center to receive services, and then we're linking you directly with a provider within your neighborhood, within your community, because we want to make sure that the care just doesn't happen in an instant and that's and that's it. We want to make sure that we follow folks all the way through so that they know that there are resources out here.
When we return, we will continue our conversation with DWIHN's president and CEO, Eric Doeh. And later, Paula Nelson, president and CEO of Sacred Heart Rehabilitation Center, talks about their DWIHN partnership and how they are providing services to our communities. Ask the Messengers. We'll be right back.
I truly want to thank our community, and Tina, I mean that from the bottom of my heart. The folks along Woodward, the business community over at 707 Milwaukee, in that vicinity. Folks have been so tremendously, helpful and just inspiring too. And, when you have that kind of zeal, it makes you go even further because you know that you have, team members who are backing you, folks that you didn't even know or, had no idea were interested in the things that you are doing. And all of a sudden you start to do it and you find these partnerships coming, and it has been just rewarding to have that truly.
The network is the network. And it includes partnerships such as ourselves, such as all the other partners that you have. But you guys have recently partnered with the Detroit Police Department. Tell us how this is such a game changer for the community, and it's massive and it's huge. So how does this collaboration work? What's involved? How does this collaboration come into play to help assist our community as well?
Awesome question. I mean, think about this. The law enforcement community and mental health, substance use disorder coming together. That's something unheard of, and this truly was an idea of one of our board members. He and I were having a conversation and expressed, hey, how can we, partner with the Detroit Police Department and the city of Detroit? And this was during, the height of the George Floyd, just awful matter there that all of our communities were so affected by. And we wanted to make sure that the folks who we serve, when they came into contact with law enforcement or vice versa, that those resulted in, situations that we could both walk away feeling as if we've been able to dissolve whatever heightened situation we were faced with. And so when Mayor Duggan and at the time, the Detroit Police Department, we came together and it was like, how can we do this? We decided, Tina, first of all, we needed to invest dollars. And, look, sometimes, folks get these great ideas, but the dollars are not there. Mm-hmm. My belief is put the dollars towards it, and the success of that will then get other partners to come in. We embedded our clinicians within the call center at DPD. Imagine that. So now folks are calling the call center there. And if you're going through that, mental health, you need some help there, you're talking to an actual clinician. Mm-hmm. We also trained a dispatcher there as well, to be able to identify with these callers and be able to deal with those situations. We went a step further. We embedded clinicians to ride along with our patrol officers. So now those officers have the confidence that when they respond to those, mental health runs, that they're actually going with someone who's a clinician who knows how to deal with the individual. Took it a step further. How about training the officers in CIT? Those are our crisis intervention training. And at first, Chief White, was like, you know what? I know you guys said that you wanted to train about 20% of my force, but I want all my guys, and ladies, to be trained in this. I was like, seriously, Tina, it was like, this dude must be kidding me. He was like, no, Eric, I'm serious. I was like, let's bring it on. And so we had that investment as well. The city also stepped in. Mayor Duggan, he really put the force of his office behind this, and that became so apparent in their investment of time, their investment of resources. Chief White took it to another level by having, his team just truly involved in this, and that was so terrific. And so we also had the homeless piece as well. Now, Tina, let me make sure I get this right. Not every homeless person has a mental health, challenge. Because sometimes folks, tend to put those two, group of individuals together. But we know that folks, who are transient, they need resources as well. So we also brought that aspect into this partnership. This thing, Tina, it has, you can see parts of it. And whether you're talking about places like, Florida, Miami, for example, Arizona, for example, but nothing has been done on this level, getting that type of partnership. We have even branched out with other, police departments, Livonia and Canton, Westland. The same is true at the airport as well, Grosse Pointe. We are expanding this. And then we've had our grant partners who've stepped in to put dollars towards it, because everyone wants to be on a winning team. And the success of this has truly proven, a valuable resource. And so we're so happy, we're so excited, and we want to expand it even further. And for communities, who are, I wouldn't say copying this, but communities who are using this as a means to hire clinicians within their law enforcement department, that is terrific. It is a good thing for the folks we serve.
We'll be right back with Paula Nelson, President and CEO of Sacred Heart Rehabilitation Center, talking about their DWIHN partnership and how they are serving our communities.
Would you like to help us save lives? You can do so by partnering with us here at Ask the Messengers by making a donation of any amount. The people in your communities need your support. Help us extend our reach and impact more lives. Supporting our organization is as easy as a click of a button. Just visit our site shown on the screen from your phone or computer, where you will see a yellow donation button. Ask the Messengers is waiting on your partnership, and your community is waiting on you.
on this Detroit Wayne Integrated Health Network Partnership Series, we want to bring you some information from one of their other partners, the Sacred Heart Rehabilitation Center, with the CEO, Miss Paula Nelson. So Miss Nelson, welcome to the show. And Miss Nelson is happy to have you here.
Well, thank you for having me today. And I really appreciate you wanting to learn more about our services at Sacred Heart.
What is Sacred Heart and what exactly do you offer to the Wayne County residents?
So Sacred Heart is a provider of substance use disorder treatment services in Michigan. We are the largest provider of publicly funded services in the state for adults. We have 11 physical locations around the state, and we also provide a variety of services in different communities throughout Michigan. For Wayne County, we provide detoxification and residential services at our facility located in northern Macomb County. Specifically on that campus, we have a women's specialty program called Clearview. And at our Clearview program, we provide services to women that need an all-female environment, mothers that have children with them, and pregnant women. If moms bring their kids in with them, we can accommodate children from birth to 10 years of age. If the kids are in school, we will work with their local school to either get homework packets or connect them in virtually, especially during the pandemic.
Tell us a little bit about the room that you're in right now and what goes on. What's the magic that happens in there?
This is our childcare room. So for the moms that bring their kids in with them, while they're in services, we have staff that take care of the children. And the first thing that we really try and do with the kids is we try and make them feel safe and loved.
What is the process to be able to be selected to be one of your facility residents? Okay.
So an individual, if they call us first, we're going to find out what area of the state they live in, and then we're going to connect them with the access center that's appropriate for them.
Okay.
Or they can call, say, Detroit directly, and they will be screened for services. And they're screened using the American Society of Addiction Medicine patient placement criteria.
Okay.
And once they're screened to meet criteria for a certain level of care, then we obtain an authorization and we can schedule that individual for services.
So every program has a success story, and every program has their own individual testimonies. So think of someone that you can remember throughout the years that you started this program. Give us one of those good, I just can't believe it, but I'm so excited about testimonials that you've experienced throughout your time.
There are many. I have to say it's probably not one specific story,
Okay.
but a variety of stories. We have a lot of our Sacred Heart team members that have come through either our program or another treatment center and are working for us. And they've been able to rebuild their lives. They've been able to regain custody of their children, go back to school. We have a peer recovery coach right now that started out in our program in 2018. She thought she lost everything, but she was able to slowly pay her legal fines, go back to school, build a relationship with her children that had been destroyed for many years, and also build a relationship with her children's father, who she also was not involved with anymore. Wow. And so to see her smile today, to tell her story, to know that her life is on track, she owns her own home, she is able to see her children. That's why we're here. Again, what I started out with, to provide a safe and loving environment for the kids and keep families united or to help reunite them. That's why we do what we do every day.
There's so many success stories. There's so many things that we hear about on the news that's bad, this and that, and this and that. But, here at Ask the Messengers, we get a chance to share those good stories, to share that good stuff, to let people know that recovery is possible and there is a way out and there is hope. And then it's people like yourself and many of the providers through the DWIHN network that provide hope, that provide encouragement, inspiration and motivation and all of the above, right? what is the process that you guys kind of like take them through? Take me through a day.
First thing we do is we'll bring the moms over and their children, and we'll show them their bedroom so they can put all their stuff away. And then we take them around. And usually when the kids see the childcare area, the room that I'm in right now, they light up. They get excited because the room is full of toys and different things for them to do. So that's how we start, is again, just trying to make the mom and her kids feel comfortable. And then we go through an orientation process with the mom so that she understands what to expect from us and what we also expect from her, including the expectation that she's going to take care of her kids.
We do a segment throughout our shows, Women Do Recover. And our street reporter, LaShawn Battle, she has over 25 years clean and sober, right? And with this segment that we do, a lot of times women, there's this thing that women can't get recovery, women can't go in treatment because they have the responsibility of the children. What you're saying and what you're sharing is you heal the family. Bring your children. We got you, right?
Absolutely.
Wow.
It is the number one barrier for mothers accessing services is what do they do with their kids?
Yep.
And being a mom myself, I wouldn't want to leave my kids somewhere. I would want my kids to come with me. So we're very proud of the fact that we're able to provide our Clearview services to mothers that have a need to bring their children in with them.
And I love that name, Clearview, because that's what we're trying to do. When you're going through and you're trying to find your way back, you need that clarity. You need your vision to become clear, because I know for a fact, when you get the women in, they just probably thought that they could never get their lives right because the world kept saying, you can't. But now here you are telling them every day with their children, everybody's healing, which is great, which is absolutely great.
Yes, as you said earlier, they can recover.
Yes.
And do it with their kids.
And do it with their kids. Wow, that is so amazing. But before we let you go, is there anything that you would like for our viewing audience to understand and know about your program, just about life in general, from one mother to another mother? Would you like to share some final words of thought, encouragement? Just what would you like to share right now?
I would just like to share that if you need help, if someone out there needs help, reach out. It's okay. We understand there's a lot of shame. There's a lot of fear for accessing services, but we are here to help, and we're going to walk with you side by side to get you through it.
Awesome. So where are you guys? Give me the information.
Yes, our Clearview facility is located in northern Macomb County in Richmond Township. Our website is www.sacredheartcenter.com. And if you go to our website, you will see where all 11 of our locations are throughout the state of Michigan.
Awesome. Thank you so very much. And I commend you. Thank you so much for being a guest today, sharing your valuable information, and just helping us to continue the narrative that women do recover.
Absolutely. Thank you for having me here today. And also, I want to thank DWIHN for their partnership over the years.
And we appreciate them as well. So you take care. And I love that space. I could just see the children running around there, getting to know each other and just playing. It's so wonderful. And thank you for sharing your space with us. You know, most times we do Zoom people in their offices. It's so great to be able to see where people get their lives together right there in that space.
Yes, absolutely.
Well, that concludes this week's episode of the Ask the Messengers TV show. Thank you again to the DWIHN Network for all they do to make our communities a better place.